Now, I'd like to welcome Dr. Sarah Park and Attorney General Clare Connors, two of the busiest state employees in our state right now, to discuss how the state is responding to the public health crisis from both a legal and health perspective. So last week, we had Dr. Ashton from HPH on our show explaining how the private hospitals and healthcare system really ramped up to deal with a potentially large number of infections. It is too early for any kind of post-game analysis of this pandemic, since we really still are in the middle of it. But Dr. Park, can you share with me and the audience the top two concerns you have had dealing with COVID-19?
I think in terms of the public health perspective, I think it's our ability to maintain the social distancing. I mean, we know how to deal with this pandemic. We know how to deal with any respiratory disease. I've often said in the past, actually, in flu season, and people might remember this, that if we could get people to always wash their hands and keep their germs to themselves, to stay home from work when they're sick, that we would see an end to flu. And the interesting thing, by the way, is that we've seen our flu numbers really come down like a rock, just come straight down, that we haven't really seen a lot of other respiratory pathogens. So it just points to the fact that our social distancing measures do work. And so that's really the biggest concern, honestly, is how do we maintain social distancing going forward? Because this is a marathon. The other concern, honestly, that I've said many times before is that as we are working to win the war on this pandemic, that the great tragedy would be that we come out of this with so many other tragedies, other things that were neglected as a result, that there are other costs that everyone needs to consider. And so those are honestly have been the two concerns. But obviously, I can't deal with the second concern. That's where Claire and other folks come into play. And my concern is really the first one. That's what I try to tackle.
So let me throw this to you, Claire, and this is a little bit kind of on the fly because we originally weren't going to have you come in, but thank you so much for joining us right now so we can have a three-way conversation. When Sarah says, the thing about the other potential consequences, one of the things we're looking at is the orders coming out in various, on different days amongst different counties. So what are the legal principles that are important to this administration in standing up any particular order, whether it's regards to certain procedures that we might be adopting, so that we don't lose sight of the larger picture and that we don't have other unintended consequences from this public health crisis?
Right. Thank you. So I do appreciate that question and do think we need to really sort of sit back and frame what it is we're looking at. What we're looking at right now is an emergency situation, right? And what we have put in place now has really derived from a very unique set of powers that the governor has to declare an emergency, to take swift, extreme action in ways that we haven't seen recently, or maybe at all, in the kind of form of 14-day quarantine orders and things like that. And I'll be clear to say that it's a 14-day traveler quarantine, because the important thing to note is that a lot of what Sarah just talked about are concerns that she's always had, are things that she has always done, right? The Department of Health, and in particular her division, has always surveyed our population and our incoming travelers for disease. And the influenza-like illness is something that's not new. As she's told everyone many times, she's been doing that since 2005. But something very different and very new has happened with respect to all the different effects that this is having, because it's a worldwide pandemic, and there are a number of considerations that suddenly require the coordination of a lot of different faculties in government. And one of those has been the emergency powers that the governor has. But I think it's very important to be clear that what we are in right now is an emergency situation. And what we're trying to do is navigate our way to that new normal, or that next phase that everybody talks about. And we have to do it in a way that makes sure the science and the data and the health concerns is the primary mover, that we are moving forward because we can justify it for the scientific and health reasons, and therefore that we're going to create a system that is going to be safer and that is also going to be legally sound. And that's a very careful and considered process that all of us are engaged in, on all the different conversations that we're having at the director level, and all the different fora that we try to participate in. And we're participating in a number because the public message needs to be that government gets it. We know what's happening and we're working on it. that we do find a way to move past things as extreme as a 14-day quarantine. Because as Sarah will tell you, we are right now quarantining people under this travel quarantine who have not necessarily exhibited symptoms, who don't necessarily come from COVID high rate places, but we have to do it because of the nature of this pandemic and the epidemiology of the disease. So we do want to be able to move to a place where we are working on screening measures that are more tied to what we see coming in the way that we were prior to this, but in a way that really does account for all the differences that we have to just acknowledge exist now.
So we have a question from one of our participants, and this is for Dr. Park, and you're not going to be surprised by this question, Dr. Park.
Okay.
The question is there a proactive plan for scaling up COVID-19 testing and potential contact tracing for arriving passengers to the state?
Yeah, so I would say it's not, I would not focus on arriving passengers only, honestly. Our plans encompass the entire community, including travelers, which I might point out over and over again, if you look at our data, it's our own residents that have been driving our wave here. It's not the visitors so much as our own residents. So our plans for contact tracing, for investigations, for testing encompass the entire community. And so that said, I'm not going to take up your whole show going through every little thing, but I will say that it is predicated on, as Claire commented, our surveillance plans that have been in place for a long time. I think it's important for people to understand that being in Hawaii, we've always worried about a pandemic. Whether people out there realize it or not, it's always been at our forefront of our mind. And so based on that, we have always been building and enhancing our surveillance systems. And the only difference is that we're in the middle of a coronavirus pandemic, as opposed to, we always thought it would be a flu pandemic, which still is out there, by the way. And so all of our systems are really based on the things that we've built around concerns around flu pandemic. And, so those are they're being strengthened now. There are concerns. We've had long concerns about making sure, that our public health infrastructure is strong enough, and clearly we could use more help. There's a lot of things in the state system, state processes that we need to address to make things more facile in terms of making it more possible for me, in the department to be able to bring on more staff more readily and such. But the thing is that I think people need to understand is infrastructure is there. The plans have long been there. It's just now about how do we make ourselves more nimble. But I also want to end with saying that it's not just about government. It's about all of us in the community. Again, social distancing, the controls that we're all seeing, the quarantines and such, those are things that government is putting in place. But moving forward, when those controls are no longer there, it's the responsibility of each and every one of us to think about, the recommendations. We've long said before that when you go traveling, when you come back, you should be monitoring your health for 14 days, at least a couple of weeks, and let your doctor know if you become sick and things like this, and you keep your germs yourself, basically. So it does become also partly, our own responsibility in the long run.
So Sarah, I'm going to pull you back into the contact tracing question because I've heard you use this term, and I think it needs to be used in the public. The term is to surge from within. So I know that there's lots of people who want to step forward and volunteer, but what's been amazing to me is that you've tapped public health nurses from the DOE to be contact tracers. So what we really need to do, and the better plan, is to surge from within. Can you kind of explain that? That maybe you will be hiring more people, but
you said DOE, but I'm going to correct you. It's DOH. So the public health nurses are within DOH. But yeah, I have been. We've surged by pulling in public health nurses. We will head on to DOE, and that because the schools have been closed, the silver lining for us has been the public health nurses have more time for us, and so it's been easier for us to pull them into the surge that we need. There are also other people within the department who can also be tapped, and we've been pulling those in. Our colleagues in the communicable disease division that normally deal with HIV, STDs, sexually transmitted disease investigations, we pull them into our surge capacity. So that is always the ideal, is to try and pull in from existing resources within the department, pull in from people, areas that are already kind of familiar with the work that we would do, and in terms of the contact tracing. The contact tracing basically is we identify a case, we talk to that person, and we ask them, how many persons have you had face-to-face contact with? And then we go to those persons that are identified, and we tell them, you've been identified as a close contact. Now we've got to monitor you. And by the way, the person was confirmed as a case. So now, unfortunately, you have to be in quarantine as well as we monitor you. And that can be labor intensive. We know, looking at our data, by the way, that the maximum number of persons identified or contacts for a case is about 43 individuals, which is a lot. But the good news is the vast majority of people, the average is really around 2 people, the 2 people that we, are connected to one person that are deemed a close contact. So it's not everyone that have this gargantuan close contact network. It's going to be most of us that are probably going to have only 2, maybe 4 individuals at most that really require that quarantine. But obviously that's a lot of work. And so surging from within is preferable, but definitely we want to also think about how can we surge from resources outside. And toward that end, we're building or I should say strengthening existing partnerships, like with the university.
So I don't want to ignore this question because Stuart Yerton put it into our comment section. He asked very specifically, how many additional contact tracing staff, if any, does the Department of Health need to, 1, first reopen the economy locally, and then 2, to open it for tourists? That's a hard question, right? It's
a hard question because look at our epidemic curve, that graph on our website that shows you number of cases over time. And if you look at it, we're only at, a single digit number every day. And so it's a very different picture from when we were at the peak of the wave, which was like 30 cases a day, essentially. And so I would give you a very different answer now compared with then. So it's not, I guess what I'm getting at is it's not about how many more contact tracers do we need. It's more about, do we have the framework in place, and not just in public health, but throughout society, to be able to reopen? And when I say throughout society, it's the controls, all those things that Clare is working on and others, to make sure that social distancing continues. Because it's not just about what we do in public health. It is a lot of, it's a collaboration, it's a combination of efforts. What we do in terms of public health investigations and contact tracing, hand in hand with what we call community mitigation efforts, all those controls, whatever you want to call it, safer home, safe home, those controls are really critical to slowing down and stopping a pandemic wave.
So on that note of these controls, and I'm going to just put it out there because, it's the talk of today with the retail opening and kind of what are they opening immediately in 2 days or on May 15th? Clare, can you comment to that? Because I think this is precisely an example of where we have to have strong community mitigation and understanding about what it is to reopen. So you want to comment, Clare, on any of on what might have happened and now how moving forward we're going to be moving towards May 15th, at least on Oahu and maybe Maui, to reopen our retail community in a slower manner?
Sure. So I think it's important to note, and I can just frame the conversation a little bit based on the 7th supplemental emergency proclamation that the governor did announce and put into effect yesterday, that this conversation is a collaborative conversation. It is, again, driven by what CDC, Department of Health, what our science and our data tells us we need to do, and also with a number of different models that have been put in place by this public-private partnership that I know the House Committee has talked a great deal about, and that Alan Oshima's involved in, Haima's involved in, all of us are involved in. So there's been a lot of thought as to how we model this with, again, CDC, DOH, our health stanchions at the forefront, right? So that's how the EP that was issued yesterday is drafted, and that's how the county EPs are drafted as well. And everything that we reference in here has to be CDC guidance driven. And a lot of the different standards that I know the members of the House Committee are working on are also driven by standards that are related to COVID-19 and this new reality that Sarah was talking about, because it is a marathon. It is something that's going to affect everything. It's going to affect how we live moving forward, how we build moving forward, how we eat in public places moving forward. So The main thing that we can tell everyone to look towards is the CDC guidance and any sort of best practices COVID related that relate to your business or your operation. And we are scaling this in a very cautious and again collaborative way. As you know, and as you just said, we're saying that these things can start to happen statewide on May 7th to give time. They don't have to happen on May 7th. If you are a business or an operation and you do not have plans in place, you do not have the ability to be safe in your operation, then you don't start on May 7th. But the ability is there if that is something that you are up to speed and able to do. And yes, we want to ensure, as we collaborate with the counties, that they have flexibility. And that's been a very strong aspect of the governor's plan in this whole period, right? Is so if Mayor Caldwell has specific concerns about Honolulu, then those should be addressed. And that's the kind of flexibility that you see in this proclamation. So we have a number of exhibits, one of which is Exhibit G, which identifies statewide what these designated businesses and operations are. So they're not necessarily essential businesses, which have always been allowed to operate so long as they engage in social distancing and follow the guidance. But now we have these additional businesses that have come online because as the models show us, they are in a low risk category. And I know all of this is being informed by Johns Hopkins and a lot of these different models that are out there, but then they've also been put through the grinder for our think tank as well to see how they match our Hawaii community and our business communities and such. So in that Exhibit G, we also identify the differences by county. So as you noted, Maui is moving at a different pace with respect to retail, and that's fine. Mayor Victorino and his team there have identified a different set of needs, and so they're going to proceed on a different timetable. And that flexibility is important because every county is different. But the primary thing for everyone to take note on is that there is guidance out there. There is a safe way to do this. And when you feel that you are able to do that, that is when you can operationalize your business or your activity pursuant to this emergency proclamation.
So I know we have retailers out there who are eager to get back, but they also really, really want to come back in a safe manner. So they're already, I know, looking at guidance. They have corporate policies. They're pulling in, what other countries are doing. Sarah, from your perspective, could you say, as a scientist, as the epidemiologist, there's lots of back office sort of things that they have to think about, staffing, they have to think about the public facing. What is like maybe one or two just really good guiding principles that they should follow as they're ramping up their procedures? And thankfully for Oahu, being able to take this week until May 15th to really get those plans in place. What would you suggest to them, Sarah?
I think, there's a lot of things that they can do to be proactive. First thing is not to rush. As Claire said, even though there's a date out there, they shouldn't say, look at that as that's the goal, they should be looking at their own practice, their own business and thinking, carefully considering, do they have the means to open? As Claire said, and that means, do you have a good plan? Do you know how you're going to ensure that your staff and your customers are safe? And that means maintaining that social distancing. That means also making sure that surfaces that are high touch surfaces are cleaned on a regular basis. How do you control the traffic? Especially if you're a small store versus a large store, that's going to take some more thought. If you're a very small space, then obviously you don't want a lot of people in that space. So how do you control that? And so thinking through, and maybe that means working with, maybe you're in a space that's a shared, in a mall setting side by side with others, and maybe there's security. So maybe it's working with that mall security and trying to decide, what's happening outside your store to be able to understand then how do you control things inside. Signage, simple signage, fun signage, even to sort of get people to sort of remind people, that it is about social distancing. We're talking about changing a culture here. I mean, not just here in Hawaii, but everywhere, right? Across the Western world. In the Eastern world, you could argue that people have been more used to wearing masks for pollution, really, usually, and things like this. But we're talking about really changing a culture for an unforeseeable time, honestly, regarding social distancing. But we also don't want to have a world where we don't have that human touch in a way, that we disconnect from each other, because that's also problematic. So it is about just planning carefully and then opening as you are ready, and not rushing into it without considering all the different issues.
So we don't have any more other questions popping up on our Facebook feed. And I really want to give you folks the closing final messages. I'm going to turn to you first, Clare, AG Connors. Any final message you would like to leave the public with as what you can expect in this time? And anything you want to say, any final message? I know there's a lot, but something.
Yeah, there is a lot. We are obviously working on a number of different issues, and how this affects all the different legal matters are too many to enumerate. But I do think that, as Sarah noted, we've kind of reframed the conversation around this idea of safer at home, and the idea is to tell people that we are going to be reopening. We do believe that there are models and there are capacity issues that we can manage and things like that. But I do really want to make it very clear, especially for the domestic violence community out there, that this safer at home is exactly that. You have to be safe at home. And there are a number of people in our community for whom the stay-at-home orders have made them less safe at home. And if you are in a dangerous situation, if you are in a situation where you're being abused or where there is something that is a problem and you are not safe at home, you need to get help. And if it is a critical type of scenario, then you need to call 911 and you will be helped and you will find resources. If you need to understand whether or not you should be seeking help or you want someone to talk to, there are a number of community resources out there for domestic violence victims. And I'll just say one is DVAC, which has a helpline, and I'll give the number. It's 808-531-3771. So it's very important as we move into this that we understand that this has really changed a lot of our norms. And in this last 2-month period, staying at home has been hard for a number of people, including those who are victims of domestic violence. So that's really the message is we need to continue to look out for everybody in our population. We need to continue to figure out how we're going to survey and monitor our population for sickness, but also for all the different changes that our people are experiencing now, because they are too many to enumerate, but we all need to take a very clear action step in ensuring that we address as much as we can.
Thank you, Clare. And you know what, that goes to that topic that Sarah was earlier saying, that we can't forget about all the other things, because it would be a tragedy if we forgot about all of these other issues like domestic violence. Dr. Park, your last message, final words.
I just want to reassure people, speaking as your state epidemiologist, as someone who has had long experience and potentially even dating myself in that, saying that this is not my first SARS and this is not my first pandemic, unfortunately. So speaking from that experience, speaking as an infectious disease physician, that we are working hard in the Department of Health to make sure that whatever guidance that we provide is predicated on science. There is science and evidence that, as Claire also mentioned, that is moving our guidance, our recommendations. We are aligned with the Centers for Disease Control and Prevention, and that we are having active discussions with other colleagues. I am always talking with other state epidemiologists to share best practices to better understand this disease, and then to understand this is a new disease. And so there is still so much that we're learning about it. I hear a lot about people wanting to get tested. There's concerns around asymptomatics, people with no symptoms. And what I would put out there is, hopefully you are trusting that Department of Health, as I said, we're basing everything we do on science, on our long experience. We have long had strong surveillance systems, actually some of them at the forefront of what a lot of other states are doing as well. And we're continuing to enhance those. And I think the important thing to note is when you think about, those concerns around people with no symptoms and whether you should get tested or not, the data is beginning to really, really show that what we've been talking about, social distancing, it works. And that actually the key to this pandemic, especially around those people with no symptoms, is maintaining that social distancing. With normal infectious diseases, and even with this infectious disease, it's not usually people with no symptoms that drive the disease spread. It's usually people with a lot of symptoms, especially with fever, means they're shedding a lot of virus, right? And people with little symptoms or no symptoms don't usually shed a lot of virus. And so they're not usually seen as the driver. The difference here with this pandemic is because everyone is so hyper aware of people with illness, you're keeping away naturally from those people. But I would bet that there are a lot of people, you see someone who looks well and you tend to gravitate towards them. So I'm asking you all, and myself included, to try and keep your distance from others. It's hard. It's talking about a culture change. But as I said, the data is really showing that is going to be what makes the difference in overcoming this pandemic as we move forward.
So thank you to you both. You can come on my show, on this show, Talk Story with House Majority, anytime. I will also say I love science because I think we have to really follow the science and really pay attention to what Dr. Park and state epidemiologists around the country are saying. So thank you for joining us. Thank you also to Representatives Aquino and Yamashita for joining us at Talk Story with House Majority. It's more important than ever that we stay connected and informed during these uncertain times. Please follow the House Majority on Facebook, Instagram, and Twitter at High House Dems for most recent updates. You can also visit our website at hawaiihousedemocrats.com, which has resources, press releases, valuable information on COVID-19 and what the House is doing to address this pandemic. Please, everyone, stay safe, stay healthy, stay informed. We'll see you next Wednesday to Talk Story with House Majority. Aloha.